order a sleep study? Let's talk about this. If you're a physician, therapist, or healthcare practitioner who is ready to up-level your sleep medicine knowledge, then go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician board certified in sleep medicine and psychiatry. Every video is eligible for CME credits, so watch this video all the way to the end and then go ahead and grab your credit. The CME credit link is in the video description. And if you're a physician who wants to go a little bit deeper, then get my free sleep mini course. It's Clinical Pearls for Outpatient Practitioners, and it's jam-packed with really high-yield tools that you can use in your clinical practice today. So you can get that at intrabalance.com/doctors. It's also eligible for CMEs. And then also stay tuned for news about my Clinical Sleep Kit membership, which opens a couple times a year. Doors are closed right now. It's June 2023 at the time of this recording, but stay tuned for when I open up doors again. So the Clinical Sleep Kit membership has lots of really great tools that you can use in your clinical practice, like PDFs, handouts, mini trainings for doctors. There's materials you can use with your patients in clinic. There's patient handouts. There's a community of amazing clinicians where we share knowledge, we can discuss cases, get support, because most of us don't get very much training on sleep medicine unless you did a fellowship. And even then, the fellowship training is really limited, and there's so much to know about sleep. All of our patients have to sleep, so as practitioners, it's really important that we have this knowledge. So this is a great way to gain some more knowledge and be part of a community where we can support each other. So stay tuned for when doors open again for the Clinical Sleep Kit membership. Should you order a sleep study, or when should you order a sleep study? Let's look at this. Now, sleep has so many downstream effects, right? If your patient isn't sleeping well, it's going to affect them in many different ways. It's going to affect their mental health. We're going to see higher rates of treatment-resistant depression or anxiety or mood instability, ADHD-like symptoms, a later risk of cognitive impairment and dementia in people who have undiagnosed or untreated sleep issues, or if they're simply not getting enough sleep. We also see physical downstream effects, so metabolic issues, a higher risk of diabetes, cardiovascular disease, high blood pressure, atrial fibrillation. There's so many things. So it's really important that we have sleep on our radar, even when patients aren't specifically complaining of sleep issues. It's important that we're asking about sleep because patients aren't necessarily bringing it up. Many of us live with poor quality sleep and don't even realize it, right? It's kind of normalized to be tired and to not be sleeping well. So we need to be asking about it, and we need to be testing for it. You're going to have patients where it seems pretty obvious that they probably have sleep apnea. Maybe they're snoring loudly, or they're having gasping arousals, or their partner notices that they're stopping breathing during their sleep, or they're waking up with a dry mouth, sore throat, headache, they have excessive daytime sleepiness. So in those patients, you're probably already ordering a sleep study to rule out sleep apnea. And if you're not, make sure that you start doing that, right? Because untreated sleep apnea has so many effects, like I was just saying. But there are also patients where it may not be so obvious that there is an underlying sleep disorder going on. I want to emphasize that patients who have sleep apnea don't always present with those very classic symptoms or with the classic archetype of the overweight male with a large, thick neck who has loud snoring. Sleep apnea can show up in thin, petite patients. It can show up in women in a very subtle way without those classic symptoms. So be on the lookout for sleep apnea in those patients too. But also remember that there are over 80 different sleep disorders. So when we're talking about doing a sleep study and looking under the hood to see what's going on, sleep apnea is one part of the differential, but there may be other sleep issues going on that aren't being diagnosed or treated. Some of these other conditions that can be picked up on a sleep study include things like periodic limb movement disorder, which are limb movements that happen during sleep. Different from restless leg syndrome, it's related, but restless leg syndrome happens when people are awake. So you don't need a sleep study to diagnose restless leg syndrome or RLS, but we do need a sleep study to diagnose PLMD, or periodic limb movement disorder. Sleep studies can also be used to assess for things like REM behavior disorder or things like narcolepsy. Sleep studies can also be used to assess the effectiveness of treatment, for example, with PAP treatment or positive airway pressure treatment. So if a patient is on CPAP Or if they're using an oral appliance for sleep apnea, you can also use a sleep study to see how effective those treatments are and if there need to be adjustments made. So when you have a patient in front of you, they may not be complaining of specific sleep issues like I said, or they may be complaining of sleep issues that sound more like insomnia and might not make you think about some of these other conditions like sleep apnea or those other sleep disorders that I just mentioned. However, if you have a patient with insomnia who has tried the usual treatments like CBTI or cognitive behavioral therapy for insomnia, which is the gold standard for treatment, or maybe they've tried medications, or they've tried lifestyle modifications, or supplements, or other things, and nothing really seems to be working, you might want to consider getting a sleep study to make sure there isn't some underlying sleep disruptor that is causing their issues with sleep. Or your patient might not be complaining of sleep issues specifically, but they might be saying, I'm kind of tired all the time, or I have brain fog, or it might even look like depression or fibromyalgia, chronic pain, chronic fatigue, that sort of syndrome. Oftentimes, I will send patients for a sleep study when they have those types of symptoms, and it'll come back showing that there is something else going on with their sleep. So do consider doing a sleep study even when patients aren't complaining of sleep issues specifically. You also want to consider it in patients who are not responding to usual treatments for hypertension or diabetes or other metabolic issues, or again, if they have treatment-resistant depression or anxiety or something like this, you can consider doing a sleep study in those patients as well. If information like this is helpful for you, then go ahead and click the like button. Doing so helps to feed the YouTube algorithm, so this information will get out to more people. Okay, so there's different kinds of sleep studies. When I use this phrase sleep study, I'm not just talking about the classic in-lab polysomnogram or PSG. There are different flavors to sleep studies to consider. So there's your standard in-lab PSG, there's also home sleep studies or HSTs. There's split night studies where half the night it's done, so it's done in the lab and half the night is diagnostic, and then the second half of the night is a titration with CPAP or some other form of PAP therapy. There are also titration studies, which assess the effectiveness of different CPAP, BiPAP, or other PAP therapy pressures. There are also MSLTs, or multiple sleep latency tests, which are used to diagnose narcolepsy. Some sleep clinics also offer daytime studies, which are available to patients who have a circadian rhythm misalignment or shift worker, for people who don't really sleep at night for whatever reason. Not all centers offer that, but the idea here is that there are lots of different kinds of sleep studies to consider and that are available to your patients. Another important thing to remember is that sleep studies are not a final ruling. It's not the verdict. You do have this sleep disorder or you don't. Sleep fluctuates from night to night, so you might not capture a sleep disorder with just one night of testing. So if your sleep study comes back negative, showing that they didn't really have sleep apnea or anything else going on, it doesn't mean that they truly didn't have it. It's just that it wasn't captured that night. So some clinics do offer multi-night testing. You could consider, if you have a high suspicion or the patient has a high pretest probability of having a particular sleep disorder, you can send them again for a study. Or if they had a home sleep study that came back negative, you can then petition or appeal to the insurance company to get that covered for an in-lab study. Unfortunately, a lot of sleep studies are insurance driven, so we're kind of subject to the limitations of a patient's insurance plan. But there are ways to get around it. So if a PSG is denied, there are other ways you can test for sleep issues, and then things you can do to get that PSG covered. So should you be ordering the sleep study, or should you send them to a sleep clinic for a consultation? Even though I am a board-certified sleep physician, my clinical practice is a psychiatry practice. We don't offer sleep studies in my practice. And I could very well order a sleep study for a patient and do the interpretation and the treatment in coordination with a sleep clinic. But I actually opt to send my patients for a consultation to a sleep clinic so that they can meet with a sleep doctor in that clinic, they can get the appropriate testing ordered, and then they can also be set up with treatment, which is usually coordinated through the sleep clinic. So they really get end-to-end care. And I'll kind of keep an eye on things, I'll consult with the sleep doctor, and I'll review the sleep studies myself. But I actually prefer to send patients for that end-to-end treatment. I just feel like they get a better, more integrated level of care that way. There are some sleep clinics that are online and that are in multiple states that you can consider using to help order your sleep studies and get your patients connected with treatment. One of them is in Power Sleep. The other one is sleep.com. We'll put the links on the screen here. Both of them offer multi-night home sleep testing, which is really effective and convenient for patients, and they both offer really high-level care, and again, they're in multiple states, so I highly recommend checking those resources out to help support your patients with sleep. So you might have patients that say to you, I'm not going to be able to sleep in the lab, or I had a sleep study 7 years ago and it said I didn't have any sleep apnea. So for those patients who say they can't sleep in a lab, then you can consider doing a home sleep study to start with. You can do the multi-night testing, as I mentioned. And for those patients who say, well, I had the sleep study done 7 years ago and it showed nothing, sleep changes, right? It's like saying I had my A1C checked 7 years ago and it was fine. It changes, right? It's not going to be the same from year to year. Have a low threshold for ordering sleep studies in your patients. Everybody has to sleep. Sleep has so many downstream effects, and we don't want to be missing out on a fundamental aspect of health that could be affecting your patient's life in so many different ways. Also remember that sleep studies can be used to diagnose multiple different things. There's lots of different kinds of sleep studies, so do keep that in mind as you're assessing your patients. Do you ever order sleep studies for your patients? If so, let me know in the comments below. If information like this is helpful for you, then go ahead and click the like button. Doing so helps to feed the YouTube algorithm, so this information will get out to more people.